So let's talk about the two categories of patients that you say you see. The denture wearers, which you'd like to see more of.
Okay.
So what are their options for dental implants when they go to your practice? And then the people that you cannot save their teeth, full mouth of extractions, what are their options for dental implants?
Well, the first option is, let's say you have a patient for lower teeth. We can place 2 implants. They'll have a snap in, snap out. They're okay.
So like a full arch of teeth that snap in, snap out.
Correct.
Okay.
The patient remove them every day to clean. They're okay, you can chew with that. There's no adhesive on that, but they move some. The other option you have, instead of 2 implants, you have 4. You have a better condition on that because there's more support on the implants. There's no pressure on the gums.
But it's still a snap in, snap out.
They still remove them
okay.
and place them every day. For the uppers, actually works really well because on that case, if you have 4 implants on the patients, we get rid of the roof of their mouth.
Okay.
And that's a huge difference for the patient.
Because on a denture, the roof of the mouth is covered.
Everything gets covered on the denture. The denture, we use that as a suction. So that part's removed. You only have the part on where the bone is. What's the big difference? They can taste better food with that. A lot of taste comes from that. Okay. Then the next step of that, you'll be 4 implants on the lower. That's a huge difference for the patient. Why? Because everything gets fixed. You have a new set of teeth in one single day. We place 4 implants, everything gets fixed. You can eat whatever you want. You can chew whatever you want. Your smile is great. You can customize the way your smile is. And the same works for the upper. We can do the upper and the lower new set of teeth the patient at the same day. Get back the patient had before a natural chewing capacity.
So these don't snap in, snap out. These are like brand new teeth on the upper and lower.
Those are brand new teeth, upper and lower. They do not. The patient can remove that. They'll come back to our office. We'll remove from them every 6 months. There's a maintenance.
So they go in for a cleaning.
They exactly like that. Every 6 months they go for a cleaning. They come back. And we do a maintenance like they do with the normal teeth.
Okay, so they just come in for cleanings, things like that.
It's
now, what about
exactly
eating?
that.
What could they eat? I mean, could they eat chewy things like a pizza or maybe nuts?
Randy, there's no restriction for what they can eat. They can eat, when you have 4 implants and a fixed new set of teeth, we don't tell them there's a food that you cannot eat. They can eat whatever they want. They can eat anything as their normal dentition.
So after the procedure's done, if everything works out right, how soon can they eat?
They can eat next day. We have them to have cold foods at the day of the surgery. Next day, they can eat anything. We start them with soft foods.
Okay.
But almost everything, anything they can eat with a plastic knife and fork, they can eat after the next day.
So no more dentures? No
more denture. We don't like denture. We want them to have a normal set of teeth.
So do you believe that like in 20 years or 50 years or however long that traditional dentures, the way we know them today, will be gone? That means everything will be attached to implants or something in the mouth?
I'm sure everything will be attached because nobody likes dentures, Randy. They can get used to that. But if you ask a patient if they like dentures, I guarantee you're not going to find anyone that likes dentures. If you ask a patient that we work with implants, have a new set of teeth with implants, they'll tell them they love that. Especially if you have a patient that had dentures before and have a denture before and have new teeth with implants now, it's a huge difference for them.
Okay, now you're a specialist, you're a periodontist. Does it cost, because there's a lot of general dentists doing this, does it cost more to go to a specialist?
No, that absolutely not. Does not cost more to go to a specialist. Will cost less probably because you'll be done right at the first time. You've
been doing this a long time. How many years have you been doing dental implants?
I've been doing dental implants for 30 years.
Okay. Is there a big learning curve, like a lot? Because it's popping up. A lot of guys doing it now.
There's a big learning curve on that. Like anything you do in life, you have to have practice for that. As more than you do them, if you do that every day, I'll give an example.
Okay.
I like to do wisdom teeth. I don't do them every day. Okay. When I have wisdom teeth at the office, I'll send it to our surgeon. Why? Because they do that every day. Dental implants is the same. We do that every day. And it will be easier or more predictable to do someone that does that every day. That's our everyday work.
How old can you be to get this done?
We have patients that we did when they are 18 years old, and we have a patient that we did implants, they're 9 years old. There's not a really a minimal age. A minimal age, I think, it's when they have their fully facial growth. That's around 18 years old.
So at about 90 years old, you can go in, and the implants, you can do it. You get a second set of teeth.
Correct.
Third set of teeth.
Yes, a third set of teeth. We did that a year ago. My oldest patient was 9 years old, and was just he couldn't eat anymore. He didn't want to stay without teeth, and he went to the office in the morning. We removed the teeth that has a problem, placed implants there, and he left happy with a new set of teeth. Brand new teeth.
Now we should mention, I guess, how implants are normally done is you go to one guy that does the surgery, another person that puts a tooth on top. In your practice, you do both. It's all done right there on these cases. Is that right?
That's correct. In those type of cases, we don't want the patient to go to having different places. The patient goes in, we do the surgery, and the teeth and everything gets done at one visit, right there.
Now, we should mention insurance, Medicare, Medicaid. The best dental insurance doesn't cover this. A very small portion.
Very small portion.
Financing. People are financing this. Is that right?
Yes. A lot of patients, there's a lot of different ways to finance that.
Now, you're not carrying your own financing.
No.
So they have to have decent credit, but they finance it.
Correct. We don't carry our own credit, but there's always different options for the patient to finance that. And we work the patients through that. And most of the patients, the financial is really not the problem for those cases.